Well, hello, Dr. Riopelle. Let's today talk about the hyperbaric chamber you just got yourself. Tell us about it. What is it for? What is it used for?
Okay, great, Helmut. Well, the hyperbaric chamber is for applying a larger amount of oxygen to an area. For example, in wound healing, we do many cosmetic procedures in our office, and often it would be nice if the procedure would heal more rapidly and better. And the hyperbaric oxygen chamber allows us to supply a higher level of oxygen to the wound area so that the wound heals more efficiently and more effectively and in a better way.
Wonderful. That makes lots of sense. I mean, after all, it's a proven fact that, it's a well-known fact at least that as less oxygen you have, whether you go up on the mountains or God only knows where it is, that you need oxygen, and oxygen is good. I think even when you have bandages on it, I remember as a kid, the doctor tells you to take them off so that oxygen can go to it. If you have them too tightly, bandaged up and oxygen cannot go to the wound, that's not a good thing. Am I correct there?
Well, in a way. I mean, generally nowadays we try not to let oxygen go directly onto the wound, but we're trying to get oxygen through the bloodstream to the tissue to heal it. So it's really not direct contact with the wound area that we're working toward. It's oxygen going in through the lungs, into the bloodstream at a higher level, and going to the tissue through the blood, through the capillaries. So we're actually supplying the oxygen from underneath through the capillary bed rather than directly applying the oxygen to the tissue area from the top, from the outside. Do you see the difference?
Right, absolutely, and I can see that if the blood carries the oxygen, I can see that works wonderfully better. Now, I know you're using it for the wounds, and that's, I think, what it is FDA approved, but I have heard people using it for all kinds of other things. Can you shed some light on that?
Well, in actuality, it's not approved for any other FDA uses, but I have heard of other people using it for a wide variety of things. For example, there's a fairly famous football player who gets in his oxygen chamber every night after working out playing football. And, football is a very aggressive sport, a lot of trauma to the tissue, the ankles, the muscles, the joints, even the brain to some degree. And he gets in his oxygen chamber to help him heal more quickly and to help him be at his best possible way that he can play. Now, again, as I say, it's not FDA approved for that, but he feels that it helps him considerably with his career.
Well, wonderful. Well, I've also heard and read in many books that it is used for diabetes, for autism, for stroke recovery people. Is there some truth to it, even though it might not be FDA approved or whatever? Well, what's your take on it?
Yes, people are using it for all those purposes. It's being used sort of off-label. The hyperbaric oxygen chamber is actually considered a medication because oxygen is actually considered a medicine. So physicians can use it for other purposes besides those purposes that it's FDA approved for. And in those cases, it's being used for those purposes, but it's not FDA approved. Now, there are studies on many of those things, but no one has gone through the FDA approval process to actually get FDA approval. Autism is a very commonly used area. There's actually a study ongoing, too, in the San Francisco Bay Area now regarding a placement of NFL football players in an oxygen chamber to ones that have dementia. There's been a lot written in the newspapers and journals about the micro trauma that occurs from playing football, and the brain actually gets traumatized multiple times over and over and over again from all of the hits that occur. And so there's unfortunately a significantly higher percentage of football players that get dementia, get Alzheimer's disease type symptoms when they're in their late 50s and 60s. I actually have a patient of that like that myself, and as a result, the football players are being put into the oxygen chamber once they have the dementia to see if the higher level of oxygen will get to the brain surface and help to heal the trauma that's occurred there years and years earlier.
Well, wonderful. Now let me ask you, how does it work? I mean, people, they sit in it, they lay in it. How long? Give us some idea what the process is.
Well, basically, one gets inside this chamber, and then the pressure is allowed to rise in the chamber. It's a fully closed-off chamber with oxygen being pumped in, and also one wears a little mask, which is applying some oxygen as well. And the pressure builds in the chamber, which then pushes more oxygen into the bloodstream through the lungs. Most of the time, in most cases, the chambers are lying down chambers. We got the latest chamber that has just come out, which is a sitting up chamber, which I think is a big advantage to patients because they can sit there and read. One's in it for about an hour or so each treatment, and they can read, they can watch television, they can do something sitting up as opposed to having to just lie in the chamber for an hour. So I'm really enthusiastic, and I really like our chamber and the way that it works.
Wonderful. And do people take one treatment, 2, 3? Let's just say they come in and they do some surgery with you. You take out some big pimples or whatever it may be. So they want to go in to cure faster and better. And maybe as a side effect, you get all kinds of other side benefits which we mentioned. But how often you suggest they should do this?
Well, we generally are going to want to treat people at least 3 days a week for about an hour, and it might take a couple weeks for some wounds to heal. It might take less. For some of the things that they're testing, for example, with the athletes going in the chambers, as I said, the one pro athlete does it every day. The athletes that have the microtrauma to the brain, they're going to the chamber for 10 sessions in the study. Over a period of several weeks, and then they have a layoff period, and then they do another 10.
Wonderful. Let me ask one more question. You're using it for wounds. Now, most of us probably look at wounds on the outside. We get cut, a wound. Well, could one consider something inside a wound, like an infection inside, lungs or something like that? Is that clinically considered a wound or not?
Well, yes. I mean, one can consider an infection a type of a wound. Again, we're not talking about something that it's FDA approved for, nor do I know for sure that it helps that type of a problem. But yes, an infection in the lungs would be a form of a wound.
And oxygen to it, based on at least some reported side effects, not FDA approved, however, have been reported on that with that machine, right?
Well, as I say, there have been other studies with other types of treatment protocols for other problems that have shown positive results, but they're not FDA approved at this point.
I got it. So a diabetes wound, I mean, diabetes have this open, some open wounds there. Is it approved for that or not really?
Well, yes. For diabetic wound healing, it is approved. So, for example, diabetics tend to get ulcers in the legs, and those ulcers can get infected. And so it is approved for patients going into the chamber to help get those wounds to heal. Sometimes those wounds will never heal. And before the chambers, they would sometimes lead to deeper infections that might get into the bone and require, really, really unfortunate things to occur to the bone tissue. And the oxygen chamber allows an improvement in the eventual result from that type of a problem.
Well, that's great news. Ulcers and wounds like diabetics are wounds to be able to get healed, and so I'm sure that in your practice as a medical doctor, which you have a family practice as well as a dermatology practice, this will come very helpful. Well, thanks for informing us, and I'm sure we'll speak more about it, Dr. Riopelle.
It's great. Thank you for calling, Helmut.
You're welcome.